Welcome to Muscle Research Review for the week of February the 3rd, 2015. Quick research summaries for the very busy health and fitness professional. Let's start off with a new study that looked at shoulder muscle activation in individuals with previous shoulder injuries. The study involved 34 men and women. 17 had a history of previous unilateral shoulder pain. The other 17 were the control. Results showed that in individuals with previous shoulder pain, there was decreased anterior deltoid activation during all functional isometric tasks, and a decrease in lower trapezius activation during scaption and abduction tasks. Understanding these deficits should help you focus on the right rehabilitation exercises for the specific muscles mentioned. Have you ever used the deadlift as a rehabilitation exercise for low back pain? The reason I ask is because several studies have shown the deadlift may be effective in decreasing pain intensity and increasing activity for most but not all patients with mechanical low back pain. A new study asked the question, what individual factors measured at baseline could predict activity and pain intensity after an 8-week period of deadlifting? Let's bring out the crystal ball. Results are as follows. The most common factors that need to be taken into consideration to get the most out of deadlifts for back pain are less initial pain intensity, less initial disability, and higher performance on the Behring-Sorensen test, which tests the endurance of hip and back extensor muscles. The Sorensen test was the strongest predictor, while pain intensity was second. So if you're looking to use deadlifts for rehabilitation, make sure the person has sufficient back extensor strength and endurance and low pain intensity levels. Do you see patients or clients with chronic ankle instability? If so, this next study will be of some interest to you. The study looked at whether there were differences in lower extremity muscle activation patterns between those with and without chronic ankle instability. They broke groups out into 15 with chronic ankle instability and 15 controls. Participants walked on a treadmill while EMG activity was assessed for the anterior tibialis, peroneus longus, lateral gastrocnemius, rectus femoris, biceps femoris, and gluteus medius muscles. The results were as follows. The peroneus longus was activated for a longer duration across the entire stride cycle. For all the muscles, timing of activation occurred earlier in the chronic instability group. So what does this all mean? Well, we know that current treatment strategies for chronic ankle instability addresses proprioceptive and posture control deficits during gait. Now, this study shows that a focus on restoring normal neuromuscular function during gait should also be added to your treatment strategies. Lateral epicondylitis is often a difficult condition to treat. Research shows a lack of effectiveness of current treatment strategies, including bracing, physical therapy, and shockwave therapy. In fact, it's usually self-limiting, resolving in about 12 to 18 months. The question is, where else should one look when someone presents with lateral epicondylitis? If you're the type of professional that treats a patient globally rather than locally, this new study is right up your alley. The study looked at scapular muscle performance in individuals with lateral epicondylitis. The study separated the subjects into 28 patients with lateral epicondylitis and 28 controls. Here's what they found. The lateral epicondylitis group had impairments of scapular musculature, strength, and endurance. More specifically, the involved side of lateral epicondylitis patients had lower values for middle trap strength, lower trap strength, serratus anterior strength, endurance, and change in serratus anterior thickness. However, it's kind of important not to establish a cause and effect here, since weakness of the scapular musculature can be the result of lateral epicondylitis. Regardless, the study kind of helps think outside the box and look at other areas to assess, such as the scapula. If you see people with neck and shoulder pain, this next study is for you. In a previous study of elderly female computer workers with neck and shoulder pain, they found 38% were clinically diagnosed with trapezius myalgia. Now, trapezius myalgia can usually present with some of the following: a reduction in maximum voluntary force, motor control, endurance, and neck flexibility. They also present with inability to properly relax the muscle between repeated contractions, which kind of leads to fatigue. This new study focused on whether 10 weeks of high-intensity resistance training or general fitness training involving leg cycling had any changes to trapezius myalgia. The strength training group involved 5 dumbbell exercises: the shoulder abduction, shoulder elevation, the one-arm rows, reverse flies, and upright rows. Results were as follows. The leg cycling group had no effect on function or pain. The high-intensity strength training group improved strength capacity during repetitive contractions. Functional levels were similar to the health control group, and there was an increase in muscle fiber hypertrophy. If there's one thing to take away from this study, it's this. Trapezius myalgia is often associated with trigger points. Most common practice is to not recommend strength training prior to addressing the trigger points. This study is one of a few recently that goes against that assumption. What's your experience with treating muscle pain associated with trigger points? Have you seen improvements with strength training alone, or do you still address the trigger points first? Leave your comment below. Well, that's it for another session of Muscle Research Review. Make sure you subscribe to our YouTube channel if you want to get notified about future updates so you can stay up to date with the latest research findings.